Hello everyone. Today we are discussing dangerous area of face. This is a short essay question and carries 5 marks. So let us understand this topic and see how to write this answer. So if this question is asked, you will have to write the answer under the following headings. So we will write it under introduction. So we're going to introduce that which part of the face is called as a dangerous area. We will also discuss the factors which makes this part dangerous, and we will also discuss about the applied aspect. So introducing the topic. So which part of the face is dangerous? You can see this diagram here. So that part of the face, that is the upper lip area, the lower aspect of the nose, the adjoining cheek. So this part of the face is dangerous. Let us see why this part of the face is dangerous. What are the factors which makes this part of the face dangerous? So our next heading is we are going to discuss about the factors. Now as you can see this diagram here, you're seeing the veins of the face. One thing is these veins are valveless. They do not have valves. And these veins rest on the muscles of facial expression. Now, if any infection is present in the dangerous area of face, and when the muscles of face they produce the facial expression, doing the movement, the septic emboli from the infection site could be dislodged. It will travel via the facial vein, and through the deep facial vein the septic emboli will reach the pterygoid venous plexus. We will see what is this in the next slide. And from the pterygoid venous plexus via the emissary vein it will travel into the cavernous sinus, and this could be fatal. That is why this area of the face is known as dangerous area. Now in this diagram we are seeing that this is the facial vein here. So you can see in this diagram that this is the facial vein. So this is the facial vein. Via the deep facial vein, through the deep facial vein, the infection or the septic emboli is carried on to the pterygoid venous plexus. So this is the pterygoid venous plexus, which through the emissary vein is connected into the cavernous sinus. So this is how the infections in the dangerous area of the face will travel to the dural venous sinuses, the cavernous sinus, and it could be very fatal. Now the applied aspects. What will happen if the septic emboli will reach the cavernous sinus? It could bring about meningitis, which means the infection of the meninges, namely dura mater, arachnoid mater and the pia mater. So the infection of the meninges is known as meningitis. It can also bring about cavernous sinus thrombosis, which means a blood clot within the cavernous sinus. So these are the applied aspects. So these are the headings we have to write for the short essay question dangerous area of the face along with the diagram. So thank you so much for watching this video.